Okay, we're back after some more Amy Campbell here today, and we're here with Mark Halpern from illnessprotection.com. Mark, great to have you here at that channel. Welcome back.
Great to be here.
And so now you came in a little bit earlier today, and we had a chance to kind of talk about what you do, and it's probably something a lot of people don't think about, and that is what happens if they get sick. People don't want to think that they're going to get sick, but sometimes they do, and then they're in trouble, or the family's in trouble. Do you want to maybe just describe the situation that you can help people with?
Absolutely. I've been doing this for about 20 years. I'm a certified financial planner, and I like to describe it that I work with busy people, and I crash test their lives. So for people to appreciate what I do, I have to do things like kill them and maim them and retire them and put them in a nursing home and BCRA and show them everything they have. If they have things in place, great, they don't need my help. But if they don't, I help families from a financial point of view to make sure that they're covered off no matter what happens.
And you have many years experience in the business and insurance business as well, but you've chosen to focus on the critical illness component.
Right.
And the segment really is about, are we ready for the pending health crisis? So, if you could speak
Sure.
to that. Yeah.
I think it's a great point. We did focus on this area of living benefits. Living benefits are not what happens when you die, what happens if you get sick. Mm-hmm. And as you said, Hugh, which was point blank, that there's a bit of cognitive dissonance. People don't think something's going to happen to them, but I don't think there's anybody who doesn't know a family or has a family member that hasn't been affected by a cancer, a heart attack, a stroke, or whatever. And I think it's very important that people sort of know what's on the horizon. And I wanted to emphasize this and really give this over a bit more. There are three very big changes that are about to happen. The first one is that governments are not going to be capable of taking care of the elderly in this country. That's not a conservative or a liberal comment. It's a math problem. The baby boomers are about to start turning 65 in the year 2011. That's next year. There's going to be a lot of old people. Mm-hmm. They say that the industrial world is going to start looking like Century Village, and it's going to affect things. It's going to affect things that we really take for granted, and that sort of leads us to the second big change, which is people are living longer. With advancements in medical technology, there's a potential that there are going to be a lot of people long on life and short on money, with a false sense of expectation that there's going to be some pot waiting for them when they get sick or when their parents are no longer around, and that's false. A few months ago, the National Post came out with a report that said 50% of babies born today, 50% will live to 104 and beyond, which, people have to have some planning expectations a little bit wiser. And the third big change is that we've moved into an information age, or I call it a misinformation age, mm-hmm. and people are really looking to have some wisdom and knowledge. Like, tell me what happens. What do I need to plan if I get sick? What does the government provide? What am I lacking? And help me sort of fill in those black holes. And that's my job, is to sit down with people and help them that way.
And if I might add to that too, I think that we're also seeing a lot more serious illness like cancer and diabetes becoming rampant in our society. And knowing that there is no government help for that. People have to understand that even if they have health insurance, it maybe covers like this much, less than 10%, and the rest is out of pocket, and you can wind up bankrupt from that. I myself have seen women suffering terribly who were very high-powered women, professional women. They end up getting sick, and they lose their income because they're not able to work. But more importantly, they also lose their life savings or their RSP because they have to cover their treatment. How can having critical illness insurance prevent all that? And when would be the best time to get it?
So look, the best time to plan for all of this stuff is when the sun is shining. Unfortunately, most people deal with all of these things that you mentioned, Janette, at a time when they're in chaos. They've just been diagnosed, or somebody's been diagnosed. It's like, I'm sick, I need to get help. Where's the money? How do I do that? So the best time to plan is when you're healthy, and preferably when you're young. Critical illness insurance is a product that we've been promoting heavily in Canada because over 50% of Canadians don't know about it, and probably less than 25% of all advisors in Canada have ever sold a policy. So how are we getting the word out? Mm-hmm. We started an advertising campaign back in 2005 on a lot of the radio stations in the GTA to let people know about it. And what critical illness insurance is, and why people should get it, is it's an insurance product that pays out a lump sum of money. The minimum amount is $25,000, but they can get up to $2 million in a lump sum, tax-free, 30 days after a diagnosis of about 24 illnesses. The biggies, of course, are cancer, heart attack, stroke, and bypass surgery, which make up about 90% of the claims. So that's one way to get paid, and they can use the money for whatever they want. You know, pay off bills, pay off their mortgage, have the peace of mind, go down to the United States if they need, take the money and get some help down there. But at least they don't have to worry about money. They can just focus on recovery. There's another type of critical illness insurance policy where you can pay a bit more, but it basically says that if you don't get sick, after a period of time, let's say 15 years, if you don't get sick, you can actually give the policy back to the insurance company and say, here, I don't want this policy anymore, and they'll give you back all your premiums in full. So you don't make any interest on that. But, you know, it's with these low interest rates today, it's sort of like getting a 0% GIC hedge that if, God forbid, you get sick, at least there's some money there for you and your family.
So how would this work in conjunction, let's say, with a health plan? Because I think people are very fixated on, you know, I can have Blue Cross or Liberty Health, and that's all I need. What are some of the pitfalls in that? What are some of the differences? And so how does it, I guess I'm asking you, how does it work, and what are the pitfalls?
Right. So most people, again, if they have any protection at all, they'll likely have, if they're employed, they'll have some sort of group benefits. Most people in Canada will have some group benefits plan that provides them with some, you know, payments for prescriptions or for dental or, let's say, for disability. But you've got to know that when you have a package like a group plan, you know, unfortunately, you don't know what it is until you need it, and then you see it's actually not the best protection that somebody could have. So that's one type of thing. Or limited. It's limited. Or somebody can be self-employed, in which case, as you said, Janette, they can get some sort of Blue Cross plan or have their own disability insurance plan, and that would also provide them with some protection. But it doesn't give them a lump sum of money in their pocket. You know, and most people, unfortunately, are living sort of from paycheck to paycheck. I say that, you know, there's more month left at the end of the money. And really what people have to ask themselves is, you know, if I got sick, you know, how long could I manage on my current savings? And do I have access to money vis-a-vis through equity in my house or, you know, family that I could borrow from? You mentioned earlier, Janette, about some high-powered ladies who had problems. I don't know if you know the statistic, but 80% of foreclosures are because of health problems. Somebody's taken a sick.
That's what,
Our previous guest.
Oh, look at that.
Yeah.
Imagine that. So the banks, right now, the banks are the biggest purveyors of insurance products. And it's because when you're sitting down with your mortgage person, they'll just ask some basic questions when they're arranging the final details on your mortgage. They'll say, would you like your house paid off if you get sick?
Yeah.
Would you like your house paid off if you die? And you're sitting there with the husband and wife. It's the most emotional, biggest purchase they're going to make. And who's not going to say no to that? They're going to say yes. But unfortunately, if you did buy insurance through a bank, it could be a very, very big problem for you because there's a possibility that those policies may never pay out. There's a lot of controversy over.
I mean, that's interesting, but why would that be the case? I mean, obviously they're selling you the insurance product.
Yeah, it's a great point. So first of all, you're not sitting across from somebody who's a licensed insurance person. Really, people need to sit down with a certified financial planner, a CFP, and look at their entire picture holistically to see how everything fits together. So that's number one. Number two is those policies are only underwritten at the time of claim, not at the time of purchase. So it's a few very short answers, and then if there is a claim, now they start underwriting that policy. So if you've been to the doctor a year before and you hadn't written it down or there was some information that was missing.
But haven't you been paying?
Yes, you have.
Before it's been underwritten?
Yeah, and you have. And
isn't that wrong?
It's very wrong, Hugh.
Yeah.
And there was people should go to our website, www.illnessprotection.com, under mortgage insurance, and there's a whole expose that was done by CBC Marketplace on sort of this game of mortgage insurance through banks. And I think it's very important that anyone who has a mortgage and has mortgage insurance should be looking at that, or if they do have mortgage protection through a bank, they should be looking at getting something that's their own, that they control, that there's a good chance that would pay out.
So even if somebody's got mortgage insurance through the bank, it seems like it would make sense for somebody to come and talk to you about it to make sure that the coverage is adequate or is even there at all by the sound of it.
Correct, or that they could be paying less for it if they were to get it on their own. But also what's interesting, Hugh, is that let's say they buy some critical illness insurance through the bank, or they buy life insurance through the bank, and let's say they're paying $30 a month for a $300,000 mortgage. As they bring that mortgage down to $250, $200, $100, they're still paying $30 a month for that original amount. So it's a declining balance that they're still paying a high premium for. Wouldn't it make more sense to have a policy that they control, their family controls, and that would get them full value for the hard-earned premium dollars that they're paying?
How much is a critical? I guess it's a critical illness policy, or is it really a whole life policy or a term policy?
Yeah, the whole life would be more of a life insurance issue. Critical illness insurance, you can buy it as a term, like a 10-year term, a 20-year term, a level till 75, or a level all the way to 100. And it really depends on what the person's gender is, male, female, whether they're smokers, certainly their body, their personal health. Critical illness is much harder to qualify for than life insurance because not only do they look at your personal health, but they're also interested in your family history, specifically if you have parents or siblings prior to age 65 that there's been some sort of a heart attack or cancer in the family.
So it's better to get this early on too, right? Before you've got all that kind of history that they're that's going to come up in their due diligence.
Absolutely, and it's interesting. There are a lot of families who are getting now children's critical illness insurance, and the best time to get insurance is when you're 3 weeks old, because then you're healthy and it's really less expensive, and it would be just a nice way to ensure that your children don't have to go through situations in the future. Let's say if there's a family history of Crohn's or colitis or something where it's harder for the parents to get insurance, wouldn't it be nice to have something set up for the children that...
But Mark, what happens if you're faced with an illness? It's now upon you. It's documented in your medical files. Is there still a chance you could get the critical illness insurance to help you cover those medical bills?
So it really, as I said, it is underwritten, and they look at your personal medical history. So if somebody's had, a cancer or a heart attack or a stroke, likely they're not going to be candidates to have insurance approved for them. But it's really important that people go to somebody who has a lot of experience in this type of product, because most advisors out there, as I said, only about 25% have ever sold a policy. They'll sort of complete the application and throw it into the assembly line of underwriting. And I've been very fortunate to get insurance for people who couldn't get insurance or had very difficult times. And if you go to my website at illnessprotection.com, you'll see a whole bunch of testimonials there from people who had trouble getting insurance or couldn't get it. But, it's all about having certain leverage in the volume of business that you do, that we were able to help them when they needed it the most.
Now, how did you get into this, Mark? I'm just curious. What's your story? How you came to be doing this for people? I'm glad you asked that. I was licensed in this business in 1991, but my real start was in 1974, and that's when my father, of blessed memory, died of a heart attack at the age of 50. I was 11, and I was the youngest of 4 boys, and he had no insurance. There was no will. There was relatively no savings, no key to a safety deposit box. And my mother, who was 48, had to go back to work to support our family. And it was very, very hard for us. And I'm just appreciative of university loans, of all the loans and the grants that were given back then. And I realized that I come from a family who have a financial background. I've got 3 older brothers who are in the accounting practice. And I guess there was a dormant financial gene that was laying in wait to rear its head at some point. And I just saw insurance as a very much a people business. It's a business based on trust and meeting with people, and if you really look after people, you get paid. And it's nice to be able to make sure that people have families protected. And I was at a year ago, I was at a funeral, just to give you an idea of the business and why it's so important. I was at a funeral, and there were about 500 people there, and I knew the lawyer was going to send a card, and the accountant would be there, and the banker would come to visit the family, and those were really important. But I knew that I was going to be showing up to that family with a check for over 6 figures to make sure that that family stayed in their house, that those kids still got to go to university, that that wife didn't have to worry about money. That means that I'm much more important than they are. But people have to realize that insurance is part of an overall financial planning program, and you really need to sit across from somebody who's going to look at the big picture sort of from 30,000 feet to make sure that it's all done. And it's not just about insurance, it's making sure people have wills. Most people don't have a will. So are you that one point of contact then for all that, for the whole financial planning process?
That's correct. I'd be the quarterback, and I don't work in a vacuum. I work with clients, existing accountants or lawyers, and as an integral team. But I've been told by my clients that, they have an accountant, they have a lawyer, they have a banker, but everyone's working independent. There's nobody looking at things sort of from 30,000 feet up to combine all of those sources together. So they look at me as sort of that go-to person.
So if you are the go-to person and you have the whole financial plan in the making, would you recommend right away to take critical insurance coverage right away?
No, absolutely not. As a matter of fact, I don't speak to my clients about product until we've been together for about 45 minutes or an hour looking at their entire plan. And in a lot of cases, they wouldn't take critical illness insurance. Perhaps they can't qualify for it, or it's too expensive or whatever. But do I make sure that they know about it and how important it is to their family? Absolutely. And if they decide not to take it for whatever reason, I have them sign something called a waiver of responsibility as part of my planning process, which is, here, I've told you about all these things and what the risks are, and you've decided not to take it, and I just don't want to be held accountable or responsible if, God forbid, something should happen where they didn't have a product that was important for them. So my job is to tell them everything they need, and they tell me everything they want, and it's not necessarily the same.
Right. I think what I meant when I asked the question was because you specialize in critical insurance, which I guess makes you a bit of a distinguishing factor in the insurance field from other insurance agents or other financial planners. I thought that perhaps the critical illness part would be something that you would, definitely make your clients aware of. I guess what I'm thinking of too is that, today the fabric of society has changed so much in that, marriage is on the decline, traditional families aren't existing, non-traditional families are, there's a lot of blended stuff happening, and we're coming into this from all these different perspectives where there's really not always a clear-cut financial picture, or the two parties that are entering in have independent lives, or independent financial lives. And so how can you come up with a solution that sort of benefits them all, being that, a lot of women are completely independent today. They don't have a husband or husband's income to depend on. And even if they are married, they don't have it because they may be coming into a second marriage and the husband is responsible for the previous family or the previous wife. How do you deal with all this? And how do you make sure that the picture is a good financial picture, including the critical illness part?
Yeah, I think that the main point is that there's no cookie-cutter solution in any of these situations. Each person is looked upon completely uniquely, and each one has special sensitivities and aspects that are unique to that person. That's why it requires somebody to sort of look at that big picture. There are most advisors out there, and there are some very good ones, but you have a lot of people who are sort of like policy pushers, right? They sell a product. And then there are other advisors who are more problem solvers. That's the position as a certified financial planner that I put myself. I'm a problem solver. So when we go through everything at the end of the day, and it's interesting you mentioned about single women. They're very big proponents of critical illness insurance.
Yeah, because they have to be.
Right, and I'm known for critical illness insurance, but that only represents about 20% of my revenue. It's really our brand, and it's our positioning that allows us to differentiate ourselves in the marketplace, and that allows me to get in front of people who I may not be able to see based on that brand. If it was just, contact us, it's Mark Halpern, go to markhalpern.ca, and we'll help you with your life insurance, we might have a challenging business. But by positioning this whole area of critical illness where people are worried about their health care, that gets them interested, and as a result, hopefully gets them to respond. Now, there are a lot more people out there who have not responded than have responded, right? But I know we've helped a lot of other advisors in the business as well, and I get a lot of accolades from other insurance people just saying, Mark, thank you so much. My clients heard your ad on the radio, and they called me, and, why are you doing this? So we're happy to really get the message out to all of Canada, and we really haven't stopped, that it's very important that people need to take responsibility, like you said, and they have to do it when things are good in their life. The challenge is that we're so busy Life is so busy that people leave all of this housekeeping to a time that unfortunately they have to deal with it when it's the wrong time. So the key
Or
is
they
to,
just don't think it's going to happen to them, Mark.
Yeah.
Nobody thinks they're going to get that sick.
yeah, no, listen.
That's true.
I've delivered a bunch of checks to people who didn't think they were going to get sick, and they're so appreciative that.
Or that their spouse is going to die or die early or whatever. People just don't think it's going to happen to them. They hear it happening to other people. They don't
Yep.
think it's going to happen to them.
Yeah, it's kind of like you hear somebody who died, God forbid, and you go, oh, poor guy, he's a member of the Dyers Club. I'm not part of that, I'm not going there. But the reality is, we're all going to die. Likely, we're going to get sick at some point. We're all going to get old. And those are things that we have to plan for. And the best time to do it, as I said, is when things are good and you're healthy. But it really requires sitting down with somebody who can help you with a more comprehensive approach, as opposed to just here buy this critical illness insurance policy, which is very important. But it doesn't always fit in every single box. It really is based on a person's needs.
And Mark, I just want to ask, when you're looking to solve the problems of the people that are sitting in front of you, do you have the ability to look at the insurance offerings of a large number of different companies and really try to find the best fit, the best deal for your client?
Yes, I'm a broker, so that means I deal with all of the insurance companies in Canada, but we have our preferred suppliers.
Yeah.
And for me, it's always the top tier suppliers, certainly the top, half a dozen, let's say. Manulife Financial happens to be one of my preferred suppliers. I've been the top living benefits advisor in Canada for them for the last 4 years, which has been great. And I've done a lot of helping with some of their younger advisors or the advisors who are not currently involved in selling critical illness insurance to help put it on the radar, because I know at the end of the day, clients really need to hear it from people.
And it's not just price either. You want to make sure that if there's a claim that your clients are going to get the payout that they're kind of signing up for at the beginning.
Correct. It's never about price, but you do have to be cognizant of people's budgets. You can get somebody to New York by a limousine. You can get there by bicycle. You can walk. It really is all depending.
Be a long walk.
Be a long walk.
York.
But if somebody, it really depends on people's budgets, and everyone has to sort of decide, how much money can they put aside on a monthly basis for all this stuff. Mm-hmm. Once they see what the stuff is, and then they have to start paying themselves first that amount, because if they don't, nobody else is going to look after them. The bank man still wants his, the mortgage money, the TD man, or, the Visa still wants their money. Nobody's going to sort of stop, and have sort of compassion. You really need to pay yourself first.
Yeah. Okay.
So I guess just in closing, before we get your contact info, I just have one last question to sort of end the segment with, and that is, what do you say to people who really just don't believe in insurance, think that insurance is a bit of a scam? No disrespect.
Yeah.
What do you have to say about that?
There are two kinds of people in life. There are those who care, and there are those who don't care. If it's somebody who cares, I can work with them. If it's somebody that doesn't care, they're not a client. They're not a prospect for me. So if somebody has lots of money in the bank and has lots of resources or has lots of availability of money from a family member or a friend who would write a big check and help them out, then they really don't need the insurance option. But if they don't, then people like myself can do some very important work for clients and take the problems away from that person by them just writing a small check every month and put the problem onto the insurance company. And if it's done properly for that client, in other words, all the information is disclosed appropriately, and you have somebody advocating for yourself, then, I've never had a problem with a claim, and I've paid out quite a few, Janette.
That's good. Okay, your contact info?
Yeah, it's www.illnessprotection.com. Our phone, that's www.illnessprotection.com. Our phone number is 905-475-1313. That's 905-475-1313.
Okay, thank you for coming in today. And it was great listening to all this.
It was great being here, and thank you very much for inviting me today. And I really enjoyed myself. Thank you.
Great. Thanks, Mark. Okay, Mark Halpern from illnessprotection.com is the website, and we're going to take a quick break.
And
Janette?
Quick break, and come back with Sonia Anderson, who's going to play us a bit of music and talk to us about her unique style of home concerts
I
brought
can't
from
wait.
out west to Ontario.
Yes. Okay, so we'll be right back here on thatchannel.com.